How's everybody doing today? Thank you so much for coming to my presentation. My name is Ahmed Al-Mukaddam. I'm a student here at Eastern Kentucky University. I am pursuing to get my degree in my psychiatric mental health and nurse practitioning. I would like to thank you all for coming. This presentation is going to be for my class, Advanced Nursing Practice Issues, NSC A42. A little bit about myself before we get into the presentation. Like I said, my name is Ahmed. I am a registered nurse. I am living out of New Jersey. I have been a nurse for coming up on 4 years now. I graduated in 2019, and I have worked in a level 1 ER and trauma center. I've also had the luxury of travel nursing as well. I was able to work at one of the regional crisis centers in the state. So this goes without show. This presentation actually touches base on a lot of different things, and I'm really excited to get into it. The title of this presentation is called The Scope of an APRN, or an Advanced Practice Registered Nurse. So to introduce this presentation, we're going to be discussing what is an APRN, what is an Advanced Practice Nurse Practitioner. We're going to elaborate a little bit on what that is, what classifies one, what the scope of practice is for an APRN, as well as what restrictions come up and what kind of obstacles they present themselves. To start, so an APRN, or Advanced Practice Nurse Practitioner, is essentially a nurse that has pursued and obtained at least a master's or doctoral degree in a specialty. And they perform a wide variety. It really depends on what branch of advanced nursing you go into. Some go into family, some go into acute care, some go into psychiatric, and some become CRNAs. So nurse practitioners, clinical nurse specialists, nurse anesthetist, nurse midwives, these are all technically considered advanced practice nurse practitioners. And now we'll talk a little bit and elaborate more on the scope of APRNs. These scopes will essentially fall under a similar umbrella term for all branches. However, they're all vary based on the state you practice in, as well as the facility's protocols in the autonomy that it allows nurse practitioners to have. Essentially, nurse practitioners, or APRNs, they'll be allowed to diagnose, they'll be allowed to prescribe medications, as well as maintain treatment plans for patients. They'll be allowed to order diagnostic testing, as well as interpret diagnostic testing in order to meet criteria for diagnoses. They also are pivotal in patient education, which isn't too far from registered nurse's role, as well as provided counseling, community information, things of that nature. These, however, all, like I said, do vary by state, and we will get into a little bit about that. Essentially, it will be divided in 3 layers, whether it's a full practice authority state, a reduced practice authority state, or a restricted practice authority state. So the main difference between full practice and reduced practice authority lies between the level of independence and autonomy that is given to nurse practitioners. Nurse practitioners that practice in full practice states are allowed to practice to the fullest extent of their skills, education, and clinical expertise, whereas nurse practitioners in reduced and restricted practice states are also allowed to practice to the extent of their education, but not to the fullest extent. Most oftentimes it is limited due to state laws and facility regulations, whether or not they will need direct physician or psychiatrist supervision, as well as a collaborating physician. And these collaborations are usually career-long. So you can never really sign off on orders on your own as an independent provider, as you would in full practice states. If you practice in reduced practice states, you would always need a physician, psychiatrist, or psychologist to sign off on your treatment plans, prescribing medications, and these all vary state to state. And with these restrictions, obviously there's a little bit of benefit to the benefit of nurse practitioners, very little liability in terms of you practicing. The liability won't come back on you, primarily because you had a collaborating physician to essentially take that liability. But each thing is also a double-edged sword, because with increased liability, more physicians are reluctant and refusing to provide collaborating contracts with nurse practitioners, reducing the amount of providers available to communities, especially in rural and inner city urban communities. These restrictions are also very time consuming. The fact that you would need a supervising physician on top of procedures to sign off on diagnoses, to sign off on prescribing medications, these are all things that will take time away from a physician, from seeing patients, from doing things that they need to do, instead just to watch us, where we have gone through clinicals, classwork, board exams, things of that nature, to prove that we are competent and capable of doing these things independently. With these restrictions, there's obviously a lot to unwrap, because they are multifaceted and they affect multiple people. They affect APRNs, they affect physicians, they also affect the patients. Essentially, the patients have less access to healthcare, because in a reduced practice state, if a provider decides to retire, decides he no longer wants to work with nurse practitioners, those nurse practitioners, 2 or 3 of them, can work into office, and without a collaborating physicians, those 2 or 3 nurse practitioners are not allowed to practice within that state. So that takes away a lot of providers for people who seek treatment, who are on wait lists, who need follow-up care, who need specialty care. These all further hinder patients and limit the access to them, especially in rural communities and urban communities with underprivileged areas. The resources and administrative work that it takes for collaborating physicians ends up increasing healthcare costs because of all the extra paperwork, the compensation for both types of providers, that type of thing. And essentially, it affects the APRNs because a lot of nurse practitioners would prefer a holistic approach or prefer this approach. And not having that autonomy really hinders the plan of care, treatment of care, because now it would have to correlate with a treatment regimen that a physician preferred versus more nursing-centered or patient-centered. So what does this all boil down to is essentially the question here. So this essentially boils down to painting a bigger picture where it's pretty dangerous, where it's dangerous for patients, increased wait times, increased wait list, difficulty obtaining primary care, primary evaluations, follow-up care, specialty treatments, and specialty follow-ups, with increased physician shortages. It hinders nurse practitioners to find collaborating physicians willing to work above them and oversee them and collaborate on treatment plans with them. So how can these obstacles be overcome? We see it all the time in full practice states. The independent autonomy that is given to nurse practitioners significantly reduces and decompresses the overwhelming patient load to communities with limited access to healthcare. So what can be done to help push for full practice authority in the remaining states that are either restricted or reduced practice? Essentially, you can start at the lower level and build your way up. So you can start with talking to administrators, board members, chairmen, things like that to help promote more autonomy for nurse practitioners to practice within the facility itself, whether it is reduced supervision, reduced oversight, whether physicians, little things like that will help take time out of unnecessary tasks where we all know nurse practitioners are capable and competent of completing, and it can allow the physicians to see patients as well, to create better efficiency and to promote better patient outcomes. There's also things on a state level. There's ways to contacting state representatives and state senators to help change the state legislation, to help promote more autonomy for nurse practitioners, to help push for a full practice state authority, which will allow nurse practitioners to not only practice independently, but to open up their own practices. And this in itself opens up doors for inner city communities, rural communities, areas that are underprivileged, and it allows more access to healthcare, more opportunities for patient education, community education, and things of that nature. To bring it all home, yes, nurse practitioners do have a pretty vague and vast scope depending on specialty and facility regulations and state of practice. We talked a little bit about full practice state, reduced practice state, restricted practice state, as well as the required regulation of collaborating physicians and physicians overseeing certain procedures or diagnoses or prescribing medications. These are all obstacles that come to the nurse practitioners. They are obstacles that are able to be overcome through changes through protocol at facility levels to allow more autonomy for nurse practitioners. This allows us to get in touch with state representatives and state senators to help change the state legislative and laws to help promote more autonomy and independence for nurse practitioners. A couple things I'm interested in hearing from you guys is how do you guys believe APRNs can collaborate with other healthcare providers and other healthcare professionals to help advocate for change in both the clinical setting and the patient care setting? Another thing I want you guys to think about is what can be done to promote more autonomy for APRNs, and that could be on any level, whether it's local, state, or national. Thank you guys so much for bearing with me in my presentation. I hope you guys were able to take away some valuable information from this and learn something new that if you haven't already knew this information. I'm looking forward to hearing your guys' presentations as well. I hope everyone has a great rest of the semester. Good luck to everybody else. Thank you guys so much for your time.